So let's talk about gout. Reason this is important is many of my patients, primarily males, suffer from gout flares, gout attacks, and it's fairly debilitating. It affects your quality of life. It's painful. What I'd like to do today is basically cover a little bit of background about gout and who gets it and what's the physiology behind gout. How do we diagnose it in the clinic, and then what are the treatment modalities that are available. When you're talking about gout, what you have to understand is that it's basically increased deposits of uric acid in the tissues of the joint. And so why is that something that can negatively affect you? Well, those deposits can cause deformity in the joints and cause arthritis, long-term chronic arthritis, and basically destruction of the architecture of the joint, which leads to long-standing or chronic pain and debility and just overall affecting your quality of life. There's several reasons why people have increased uric acid production or increased uric acid in their body. Some people are overproducers of uric acid, and other people are under-excretors of uric acid. So in the overproducers, you basically have people who produce too much uric acid, and because of this, they have extra uric acid in their system. People who are under-excretors are people that produce normal amounts of uric acid, but their kidneys do not get rid of the uric acid efficiently enough. And so as a result, they have increased uric acid in the body. This condition is more common in males. I would say about 90% of the cases are in males. It does occur in females. However, it's more commonly in postmenopausal females. You tend to see this in males in their mid-30s, 40s, and older. It's not something you see early on, at least the symptoms. They may have increased uric acid levels, but the symptoms are not usually present until later on in life. So how does the gout usually present, and what are some of the common symptoms? Well, because you have these deposits of uric acid in the joints, this accumulates over time and it can form nodules or tophi, basically grouping or conglomeration of uric acid that affects the joints and can ultimately affect the kidneys. And what happens is you can have gouty flares where these tophi accumulate in the joint, and then eventually they can break down and have release of the uric acid, and it's painful. And what we'll typically see is a single joint that's affected at one time. It commonly occurs at night, and the typical presentation may be a person with severe pain on their great toe, their right great toe, that started at night, and it's red and swollen and painful. Sometimes it can be confused for infection of the toe or cellulitis of the toe. Some people think they were bit by a spider and now they have an infection or a cellulitis, a skin infection, but in fact it can be a gout attack. A couple of things to note. In order to appropriately diagnose gout, you really need to have an aspiration of the joint. So you'll see your primary care physician or you will see your rheumatologist, and in the joint that is inflamed and red, they will stick a small needle into this area and aspirate or draw out some fluid, look at it under a microscope or send it to the lab to look for crystals, uric acid crystals that will confirm the diagnosis of gout. Other ways that this condition can be diagnosed, although not as reliably, is by looking at uric acid levels, elevated uric acid levels, which can be detected by doing a blood draw. So your primary care physician would draw some blood and measure the uric acid level in the blood and see if it's elevated. So normal value may be 6 or lower, and if he sees that your number is 7 or 8 or 9, he can say, he or she has elevated uric acid levels. That in combination with a joint that is inflamed or with tophi that you can actually feel in the joint, it feels like a nodule. Sometimes it has a yellow hue or yellow appearance, can help in confirming that you may have gout. So what I'd like to do is talk to you about the treatment that is available for treatment of acute gout, treatment to prevent gout attacks, and then finally treatment that is available to reduce the overall uric acid level that is present in the body. When you have a flare, if you have gout and you have a flare, your primary care physician will likely initially recommend a non-steroidal anti-inflammatory medication such as indomethacin. And this works basically to decrease inflammation. It tends to work pretty well. Another option that is available for this type of flare is a medicine called colchicine, and you can take this medicine every hour as directed by your primary care physician, and this will help with a flare. If indomethacin, the non-steroidal anti-inflammatory, or colchicine are not effective, then the next step your primary care or rheumatologist will move forward with is placing you on some steroids such as prednisone, and usually that tends to help with the flares. That's basically how we treat flares. When you're looking at trying to prevent attacks, we tend to place people on colchicine. We can do colchicine daily to prevent attacks, and that tends to be fairly useful. The other strategy in preventing attacks is really to lower the uric acid level. And so there are medicines that will help to reduce the uric acid levels, and one of the common medications is called allopurinol. The other common medication is called probenecid, and these work a little bit differently. The probenecid tends to help you excrete or urinate the uric acid level or not absorb it as much in your kidneys, while the allopurinol is an oxidase inhibitor, and it will help break down the uric acid. Couple of caveats about this. We tend to use the strategy of slow and low. So it's a slow process in bringing the uric acid level down. You're measuring this in terms of months to years to try to slowly bring down your uric acid level. So you start taking allopurinol, and it's important to note that you shouldn't take anything like allopurinol or probenecid, which are medicines to reduce your uric acid level. You should never take this or initiate this during an acute attack. If you are having a flare, you should definitely not take allopurinol or probenecid as a new treatment. This will make your flare much, much worse. However, if you are currently taking allopurinol or currently taking probenecid, you should not discontinue either of these medicines when you are having a gouty flare. What you want to do is maintain stability in those tophi and those uric acid crystals, and you don't want to rock the boat too much. So you would not stop taking allopurinol or probenecid if you are having an acute flare, nor would you start taking allopurinol or probenecid during an acute flare. During an acute flare, you would rely more on the non-steroidal anti-inflammatories such as indomethacin or on colchicine. Now, getting back to the allopurinol to reduce the amount of uric acid in your body. Your goal is basically to reduce the serum uric acid level and reduce the amount of flares. You have to be careful in doing this slowly and in watching your kidney function. So make sure your primary care doctor is periodically checking not only your uric acid levels, but your kidney function as well. What you will want to do is ensure that uric acid level drops below 6. That's the value you're looking at. In some of my patients, I say, well, 6.5, 6.5 is okay as long as the number of attacks have reduced significantly, especially if you have issues with the kidney and you're kind of challenged in trying to increase the dose. So you want to weigh the pros and cons with all of these medications. Ultimately, what are we trying to do with this? Well, the long-term and chronic consequences of having these uric acid crystals in your joints can be debilitating. So this is not something that you want to just treat symptomatology. You don't want to just treat your gout whenever you have a flare, or just take colchicine to prevent reduce the number of flares you have. You want to actively reduce the uric acid level in your body in order to reduce the size and the amount of crystal formation in the tissues of your joint. Why? To ultimately reduce the chances that you would have chronic arthritic diseases, problems with your joints, and debilitating disease. That's pretty much a summary of gout. And please talk to your primary care physician about all these treatment strategies before initiating these on your own.